So on the previous slide, I mentioned that we were going to come to another system, but this next slide doesn't have it. So I'll just mention the three systems that are constantly trying to make sure that your blood pressure doesn't get too low. So it's the autonomic nervous system, it's the renin-angiotensin-aldosterone system, and the ADH system, okay, the antidiuretic hormone. And we will come to this. But those three systems are interacting with each other to make sure that the blood pressure and blood volume are consistently normal. Because the last thing the body wants to have is low blood pressure going to the brain. Okay, so this slide, we're looking at the other side of the coin. So what does the heart do if it starts to sense that there's just too much volume in the system? You've just drank too much water, or so your volume overloaded. Or say you have a condition called congestive heart failure that we'll come to, and the body, the, the, the heart is sensing that there's just too much volume stretching its chambers. Well, there's little peptides. There's little protein peptides that are secreted by the atrium, ANP, and from the ventricles, BNP. And they get released when there's just too much volume and stretch of the chambers in the heart. And what they do is they go to the kidneys through the bloodstream, and they act as natural diuretics. So they cause a natriuresis. So they're saying, so when they get secreted, they're sensing there's just too much volume in this whole system. I'm going to do the opposite and help with diuresis to flush some of this fluid out through the kidneys. Okay? So what will this do to blood pressure? Well, it'll gradually reduce it a bit because these peptides are acting as diuretics, and they take off some of the blood volume. Now, BNP is definitely the more important one. It's the one that we can actually test for in a blood test. And we will sometimes use it in the setting to diagnose congestive heart failure. And we'll get to it much more. But we use this peptide because when the heart is filling too much, because it's filling too much with blood, BNP gets released to try and help reduce the overall blood volume. Okay, so hypertension definitions. So systolic hypertension would be any systolic blood pressure greater than or equal to 140. Diastolic hypertension would be anything greater than or equal to 90 as the diastolic pressure. Now, if you're on antihypertensives, you've very likely been diagnosed with hypertension. If the values are normal, like say for example you get 120 on 80 and you're on 2 medications to control hypertension, you have controlled hypertension. You have a normal blood pressure that's controlled with medication. Often we'll suggest people to get proper exercise, lose weight, minimize salt in their diet, reduce or stop smoking, all the other factors that are equally important than just taking a pill. Why do we call this condition the silent killer? And it really is. You very rarely have symptoms from high blood pressure in your system, in the arteries. You can go for years and years and have hypertension, especially if you never get it checked. You'll never know, or you just don't act on it. And all those organs, every organ in the body gets supplied with blood to feed it. So all those organs are under high pressure. So you can imagine all these pipes, the arteries, going to all these different organs, and within the organs themselves, all these pipes, and they're under high pressure. So as I've said before, not only does that damage the arteries the endothelium, the lining within the arteries, leading to plaques, which are called atherosclerosis. We'll come to that. But also, it puts you at much higher risk of a hemorrhage, a break in the artery, and blood ruptures, uh, hemorrhages out of the artery. So hypertension is often without any symptoms until something really bad happens. So you bleed into the eye. We notice on a blood test that your kidneys are failing. You suddenly have a stroke. You suddenly have a heart attack. But prior to that, you didn't have any symptoms. Okay, so the next slide on hypertension. So primary hypertension, or there's other terms for it, essential hypertension or idiopathic. Idiopathic means we have no idea why you have high blood pressure. That's by far the most common cause. So you have hypertension, but we don't know why most people have hypertension. It's likely just the body's setting is at a much higher level, where we've decided as healthcare professionals to not leave it at that level because of the harmful effects that it does. So primary means no known cause. We don't typically investigate to find a cause because most of the time there is nothing to find. We think it's just high peripheral vascular resistance, which is the underlying body's setting, and we just need to treat the hypertension. Secondary hypertension is high blood pressure caused by another disease. And that only makes up about 3 to 5% of hypertension. And most people that come to an office, we don't investigate the hypertension. We only investigate it if there's reasons for us to suspect a secondary hypertension, such as it's resistant to treatment. They're on 2, 3, 4 blood pressure medications, and the blood pressure is not budging at all. It's remaining high. Or we do some blood tests and we see some abnormalities in the blood tests in terms of electrolytes that make us suspicious of a secondary hypertension. Examples of secondary hypertension would be something like Cushing's syndrome, where you're making too much steroids, and that increases blood pressure. Pheochromocytoma, it's a tumor on the adrenal gland, and that secretes epinephrines, norepinephrines, and they create hypertension. And there's other conditions as well that are listed here that I won't go through all of them. There's a condition called hyperaldosteronism, where you're making too much aldosterone. Well, you can imagine that if you're making too much aldosterone, you're reabsorbing water and salt from the kidneys, and that is increasing your blood volume and causing hypertension. So really what we want to do for most people that come in with primary hypertension is control it, bring it down to a normal level. And there's many non-medical ways to do that, like non-medicine, lifestyle, right? Eating properly, exercising properly, not smoking, weight loss if you're overweight. So there's many ways of bringing it down without medications. Often people end up on medications, and often they end up on medications for life for hypertension. Because the alternative is all the damage and potential illnesses you can get by leaving the patient with hypertension, which aren't good. So this slide just lists some contributing factors to why someone might have hypertension. So chronic stress, anxiety, pain, well, we see that all the time in the hospital. Stress and pain in a hospital activates your sympathetic nervous system. That's going to give you that can put your blood pressure up. Sodium retaining hormones, so aldosterone, angiotensin 2 will put your blood pressure up. Increased sodium intake. Salty foods makes you retain water or makes you drink water, which will increase your blood volume and potentially give you hypertension. Obesity causes hypertension. Cigarette smoking damages the lining of the arteries, leading to more atherosclerosis, leading to blocked arterioles, blood vessels, and that can lead to hypertension. And also, the toxins in the cigarette can be powerful vasoconstrictors. So smoking can give you hypertension. Diabetes. Well, diabetes damages arterioles and capillaries. That will increase your blood pressure because of increased peripheral vascular resistance. Alcohol intake. Well, alcohol is a direct toxin to the heart and the cardiovascular system. Until it actually finally causes heart failure, it can give you chronic hypertension. So consuming large amounts of alcohol can give you hypertension. So this slide on hypertension, referred to as a silent killer, we've already covered. Hypertension is classically asymptomatic. Some people blame headaches. They check their blood pressure and then they find symptoms that they think might be occurring because of their blood pressure. Most of the time that's not the case until something catastrophic happens with having years of hypertension. Remember that high blood pressure we try to treat it for the long-term consequences, to avoid strokes years from now, or heart attacks, or renal failure years from now. So one reading of high blood pressure is not terribly exciting, but if we get persistent and repeated high readings where we feel someone that is their blood pressure setting, then we will actively treat it to bring it into the normal range, less than 140/90. So you can see hypertension is really a chronic disease that is altered through lifestyle and through medication. Okay, so what happens once organs become diseased? Well, once organs are damaged from chronic hypertension, just depends on which organ it is. So if it's the heart that's been damaged by hypertension and you're going into heart failure because the heart can't pump against the high blood pressure, well, you're gonna have a decrease in cardiac output. So you're gonna have fatigue because you're not getting the proper amount of blood flow to the system. You're gonna have activity intolerance. Again, if your cardiac output can't be maintained because of such high blood pressure and you have congestive heart failure, you're not able to do the same amount of activity. Dizziness. Well, if you're potentially getting abnormal rhythms from the heart failure because of the hypertension, or you're getting palpitations, which are extra beats or missed beats from the heart. Angina is from the heart. Shortness of breath can be from the heart. So those are symptoms of heart failure, all of these. And the heart is basically saying, I can't pump against this high blood pressure for years, so I'm gradually failing and reducing my cardiac output. The next one, vision loss. Well, that can be from hemorrhaging in the retina. The blood vessels are rupturing and the little capillaries in the retina are rupturing. So think of almost any organ, but these are the main ones here: heart, brain, kidneys, eyes. Those are the main ones that are affected with hypertension, and they gradually begin to fail as the years go on. Okay, so I really want to stress how high blood pressure in the arteries is really going to lead to a multitude of problems in a patient over the span of years, right? So if you can imagine having high pressure in the pipes of your home, well, one of two things is going to happen over years. The inside of the pipe is going to become more and more corroded because it's dealing with high pressures, and it'll finally get blocked. Or the corrosion will then lead to a break in the pipe and a hemorrhage. Okay, and that's what happens around the body. So when we look at this slide, let's start at the top left. Well, a stroke. Well, a stroke can be an ischemic stroke, or a hemorrhagic stroke. So ischemic meaning the artery has become blocked because it's been dealing with high blood pressure and it's formed plaques from atherosclerosis, or the artery has hemorrhaged and blood has leaked into the brain. Okay, what about the heart? Well, a heart attack is from blocked coronary arteries that feed the heart. And if they're dealing constantly with high blood pressure, they're going to become blocked, leading to occlusion of the artery that will then cause a heart attack. Okay? Congestive heart failure on the bottom left. The poor left ventricle is having to beat against very high blood pressures in the aorta, which is your blood pressure, right? So if you have a blood pressure of 180/90 consistently, that poor left ventricle is going to have to get enlarged. It's going to have to develop more muscle. It's going to have to beat harder with every beat to try and get that blood into the aorta. And finally, it will fail, leading to heart failure. Okay, the kidneys. Well, the kidneys don't like to see the arteries with very high blood pressure within them, and because that damages the nephrons. It leads to a condition called nephrosclerosis, which is really just scarring of the nephrons, right? So it can lead to kidney failure. And another example is the retina. So severe hypertension over many years will lead to those little blood vessels that are on your retina. They'll start to hemorrhage, or they'll start to become blocked, leading to blindness. And basically you could look at any artery in the body, and there's going to be an effect on those arteries if you have continually high blood pressure. So there's diffuse arterial damage from hypertension. Okay, so let's look at some specific areas where hypertension causes damage. And it's really anywhere where there's arteries, which is every organ. But there's some that are more catastrophic than others. So in the brain, cerebrovascular disease. So cerebrovascular disease means that you either have clogged arteries, which I've already mentioned, hypertension can damage the arteries and clog them up and reduce flow to the brain or any other organ. So it can be ischemic, meaning there's just not enough oxygen getting there because of blocked arteries, or hemorrhagic. The hypertension led to a hemorrhagic stroke, bleeding into the brain. Peripheral vascular disease is usually caused by the atherosclerosis and the plaque formation within the arteries going to the legs or arms. It's typically the legs, and we'll get into this a bit more when we get into peripheral vascular disease. As you develop clogged arteries from chronic hypertension to the legs, you get a particular set of symptoms. Aneurysms are dilatations, so focal dilatations of an artery. You can get cerebral aneurysms, where there's little little areas of the arteries that are dilated, and they're they're getting bigger and bigger until they finally hemorrhage. You can get an aortic aneurysm. So you could have a thoracic aortic aneurysm where the aorta is getting bigger and bigger and bigger, almost like it's ballooning out until it finally ruptures. Or you can have an abdominal aortic aneurysm, which is the most common site to have an aneurysm, is an abdominal aortic aneurysm. And that's usually just before the aorta splits into the iliac arteries going down each leg. You can develop an aneurysm there. And as it gets larger and larger and larger over years, it can rupture. And when the aorta ruptures, you can imagine, this is a huge artery. A lot of people die immediately. Now, if you're lucky enough to get symptoms of abdominal pain and back pain as it starts to rupture and you get yourself to a hospital, then you can have emergency surgery to try and repair the rupturing aortic aneurysm. The other way that we sometimes pick these up incidentally is by doing an ultrasound or a CAT scan, and we notice, hey, this person's got a growing aneurysm in their aorta, and we're going to follow it. And at a certain point, at a certain size of the aneurysm, we're going to operate so that it doesn't rupture and kill this person. Okay, kidneys. Well, chronic hypertension causes sclerosis to the nephrons. It scars them. You get nephrosclerosis. So gradual loss of nephrons over years and years from chronic hypertension will lead to renal failure. The eyes, we've mentioned it. Chronic hypertension can cause retinal hemorrhages, and retinal hemorrhages will cause vision loss and then blindness. What about the heart? Well, the poor heart's having to pump against high pressures. So the afterload, which is your blood pressure, your arterial blood pressure, is your afterload. It's having to pump against very high pressures if you have chronic hypertension. So it can lead to heart failure, where the heart just gradually weakens and weakens and weakens. It can also lead to heart attacks because the heart is working so hard all the time to try and get this blood into the aorta during systole, that it's under chronic strain. That's where you can get angina and heart attacks, and we'll come to those on future slides. So we're still talking about hypertension and what it can lead to. So the next one is, so we've gone through a whole bunch of different organs. Let's talk about the coronary arteries. So the coronary arteries are the arteries that feed the heart. Okay, they actually come off. They're the first arteries to come off the aorta. Just after the aortic valve, you have your left and right coronary artery, and they feed the heart with oxygen and glucose. So, because every organ needs an artery to feed it. Okay, so we sometimes forget about that when we're thinking of the heart that just pumps along and it's just doing all its stuff, but it doesn't need food. Yes, it does. So the coronary artery. So hypertension, as I've mentioned before, can damage any artery. So because the high pressure in the arteries are slowly damaging the endothelium, and that can lead to blocked coronary arteries from plaque formation. And the plaques get bigger and bigger with time. And as it gradually blocks a coronary artery, you get reduced flow. And when you get reduced flow of blood that feeds an organ, the organ will respond. And with the heart, it responds with angina, which is ischemic chest pain. It's the chest pain you get when there's not enough oxygen and blood flow in the coronary arteries. If it completely blocks up, then you get an MI, a myocardial infarction, a heart attack. So a completely blocked coronary artery can lead to a myocardial infarction. If you get a myocardial infarction, which you've actually permanently damaged a part of the heart muscle, that'll weaken the heart muscle because that area is going to turn into a scar. And that can lead to heart failure because the pump has been weakened permanently. The heart has been weakened permanently because of the heart attack, and you can develop heart failure. If the heart failure progresses and you get weaker and weaker pumping of the heart, the fluid that's coming into the left ventricle is backing up into the system. It's backing up into the left atrium, backing up into the lungs, called pulmonary edema or pulmonary congestion. So coronary artery disease, the arteries that feed the heart, as they get blocked and damaged and lead to an MI or heart failure, the actual heart as a pump is weakening, and you're getting backup of fluid into the lungs. If it's left-sided heart failure, by the way. What about left ventricular hypertrophy? Okay, so we mentioned that this is a person with hypertension, and the poor left ventricle is having to pump. Every heartbeat, it's having to pump against high blood pressures. So what's it going to do in the short term to try and compensate for this high blood pressure in the aorta? Well, the heart muscle is going to thicken. It's going to try and get thicker and stronger, okay, to try and pump against this high pressure. So you can get left ventricular hypertrophy, and that is from hypertension. Heart failure we've spoken about. So if you're asking the heart to pump against very high blood pressures, the heart will gradually get weaker and weaker and weaker as the years go on, and you can develop heart failure, which then reduces the ability to pump blood out of the heart, cardiac output, so it'll back up into the lungs. It can cause all kinds of symptoms in the lungs that we'll get to, and it can actually back up all the way to the right side of the heart, and you can get other symptoms from right-sided heart failure. We'll come to that. Here's a diagram of an aortic aneurysm. So we've already spoken about aneurysms. They're basically a weakening of the artery that puts it at risk for rupture. You can imagine that abdominal aortic aneurysm rupturing. You could easily empty all 5 liters of blood that you have in your system out of a ruptured abdominal aortic aneurysm. So they're often asymptomatic until they actually start to rupture, where you will develop back pain, abdominal pain, if it was an aortic aneurysm. If it's in your brain, such as a cerebral aneurysm, and it ruptures, then you're going to get instantaneous headache and vomiting because of the pressure in the brain. So how would we diagnose an aortic aneurysm? Well, as I said before, typically it's just incidental. We do an ultrasound for one reason, we find an aneurysm, or a CAT scan, we find an aneurysm in the abdomen. But sometimes on examination, when you're examining someone's abdomen, you might feel a pulsating abdomen. It's just pulsating up and down with every heartbeat. Or when we're listening to an abdomen with a stethoscope, we might hear what's called a bruit, which is a flow murmur going as the blood flows through the abnormal dilatation, the aneurysm. It's creating flow disturbances of the blood and giving you bruits. So you might hear this abnormal bruit. It'll sound like whoosh, 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 an abnormal bruit um, in the abdomen. So just remember that. You might feel it when you palpate the abdomen, or when you listen, when you're trying to listen for bowel sounds, you might hear an abdominal bruit of a aortic aneurysm. So this slide's just showing you what hypertension can do to the retina of the eye. All those hemorrhages on the right side are from hypertension. So it'll gradually lead to vision loss as all the vessels, little tiny arterioles and capillaries in the retina are leaking. So this can happen in almost any organ with hypertension. This is showing you the retina.